In this episode, I would like to start with two patients' real story. So the first patient was a diagnosed case of liver cirrhosis, and he was on routine and regular follow-up. And during one of the follow-ups, we identified that he had a large liver cancer, a large tumor in the liver, about 6 centimeters in size. And this tumor had actually spread into the blood vessels inside the liver. That is, this particular blood vessel called the portal vein, which supplies almost 80% of blood to the liver. The liver cancer had actually spread into the blood vessel, into the portal vein. And there was very little that we could do at the time to give him a cure option. The cure option for liver cancer in cirrhosis is usually a transplant. But once it has spread into the blood vessels, we cannot give him a cure option. We have to give other options so that we can actually bring his stages down and then shift him towards a curative option like a transplantation. So this patient, we advise him various treatment options to take care of his liver cancer. Now the second patient is very similar to this person. Even he had a large liver tumor about 7 to 8 centimeters in size, and even his tumor had actually spread into the portal vein, into the blood vessels of the liver. And even he had the option of various palliative therapies which would help him downstage his liver cancer, and maybe in future we can offer him a liver transplant. But the decisions taken by these two patients were quite different. So the first patient decided that he was actually scared of palliative options, which includes various treatments like burning the tumor, a type of local chemotherapy, a type of radiation, and also oral medications, tablets to reduce the tumor growth and things like that. But he was scared that it was all going to be a lot of side effects for him, and he was quite depressed about the fact that these are not going to work out for him, even though we do have patients who had come in his stage and were doing well. So he decided to go for homeopathy. So he went for homeopathic treatment for his liver cancer, which was stage C. So liver cancer is of 4 stages, A, B, C, D. He was in stage C because of that blood vessel spread, and he decided to opt for homeopathy. Now the second patient, he decided that he will go ahead with what we suggest was best for him, and he did that. Now what has happened to these two patients? This is the discussion that we are going to have here. But before that, what I would like to discuss is how do we manage liver cancer in a liver cirrhosis patient from a scientific point of view, based on current evidence, and what are the latest options that we have to treat cancer in liver cirrhosis patients. Now when people hear about liver cancer, they are quite scared. But trust me, liver cancer is unlike other cancers. This cancer has a very different set of treatment options, and from the last decade, a lot has changed in treatment of liver cancer, and this episode is dedicated to liver cancer management from science point of view. So let's go. So let us start with liver cirrhosis. So liver cirrhosis has different stages. So you have stage 1, stage 2, stage 3, stage 4 and stage 5. So in stage 1 and stage 2, we have cirrhosis and its different clinical features. Patients do not have any complications of cirrhosis. So patients will have features of shrunken liver on imaging. They will have a low platelet count. They will have some skin darkening. They will have some swelling in the legs. But they will never have major complications during stage 1 and stage 2. In stage 3, patients start developing complications. For example, patients start having collection of fluid in the abdomen known as ascites, and patient starts bleeding. That is, they either vomit blood or they pass black colored, tarry colored stools, which is known as melena. And these two happen in stage 3 and stage 4. In stage 5, patients develop jaundice, which is the stage where liver failure starts. And once jaundice develops, patients can have additional complications like hepatic encephalopathy, where there is increase in ammonia in the body and patients develop altered behavior, confusion. Some can even go into coma. And a lot of them develop infections kidney injury, low sodium, and various other major complications in liver cirrhosis in stage 5. So there is a stage 6 when patients with cirrhosis become critically ill. Now the reason why I told you regarding stages of cirrhosis is because when somebody develops cancer in any of these stages, so cancer can develop in the liver in any of these stages from stage 1 to stage 6. So if somebody develops liver cancer in any of these stages, then the treatment of liver cancer is based on the underlying cirrhosis stage. So it's not so simple. So you find a cancer, you start radiotherapy, chemotherapy. That is not the way it works in liver cirrhosis. We have to look at how the patient is, his performance or her performance status, along with the stage of cirrhosis, followed by the stage of the liver cancer. So this is how we differentiate patients into stage-wise management in liver cancer. And this stage-wise management is known as BCLC staging. So this is the staging that is universally followed. There are various other stages all over the world. There is a stage known as TNM staging. There is a HKLC, Hong Kong liver cancer staging. So various stages. A lot of liver units all over the world use different stages to manage their patients, but most commonly used is something known as the BCLC staging. So BCLC staging of liver cancer has 4 stages, which is divided into A, B, C and D. So in A, patients usually have a single tumor. So I am simplifying this for easy understanding. It may not be the exact classification, but just for easy understanding. Stage A will have a single tumor less than 3 centimeters or what we call as small liver cancer. Stage B will have liver cancers the size more than 2 centimeters, and usually there will be multiple liver tumors. So this stage is also known as intermediate stage, that is BCLC-B, and then comes stage C, where the liver cancer spreads into the blood vessel of the organ, that is into the portal vein of the liver. So that is stage C. And stage D is when the liver cancer spreads out of the liver. So that is metastasis. It goes to other organs, or if the patient has very advanced liver cirrhosis, for example stage 5 and stage 6, where we cannot offer any palliative options or surgical options except for transplantation in well selected patients. So when we diagnose liver cancer in patients with liver cirrhosis, we look at 2 things. One is something known as alpha-fetoprotein, which is a blood test, and it measures the tumor activity of the liver cancer. So alpha-fetoprotein normally it is less than 10, but it can go very high in certain patients with liver cirrhosis with cancer, or it could be normal also. So in very mature liver tumors will usually have alpha-fetoprotein either slightly raised or even normal, and very immature highly active tumors will have very high levels of alpha-fetoprotein. We have seen patients with AFP levels in lakhs also. That is very active tumors. So based on the alpha-fetoprotein level and based on imaging, so if somebody has a very high alpha-fetoprotein level, or if a patient has a feature of a tumor on ultrasound screening, then we advise that patient to go for a CT scan or an MRI imaging, because CT scan and MRI can easily identify if the tumor is actually cancerous or not. So we don't need to biopsy normally in a liver cancer. So this is what patients usually ask. Why don't we go for a biopsy to confirm? Is it confirmed? Yes, we can confirm liver cancer just by looking at high AFP levels and specific characteristics on CT imaging or MR imaging. And that is how we diagnose liver tumors. If there is some doubt between the CT and MRI, for example, CT says, it looks like a developing cancer, but it has not fully developed, but the alpha-fetoprotein is very high, then we go for MR imaging, and MR imaging also says, it may be a tumorous or cancerous lesion, we are not very sure, but AFP is so high that you are clinically so sure that this is cancer. In such patients, we can go for a biopsy, just to clarify it. So that is only a role for liver biopsy. Otherwise, we don't do liver biopsy for diagnosis of liver cancer. AFP levels and a good imaging, either CT scan or MR, is enough to diagnose liver cancer. Now, once the diagnosis is done, we look at stages, that is stage A, B, C or D. Now, if patients are in stage A or B, there are various options. So, if you have a small tumor or a slightly large tumor, you can either give heat from outside and damage the tumor, that is completely melt the tumor. This is known as RFA or microwave ablation. So RFA is radio frequency ablation. Using a needle, we burn the tumor from outside, or microwave ablation where we use microwaves to burn the tumor from outside. Now usually that is good in tumors less than 3 centimeters, but there are cases where we have done this for patients with tumors, well defined round tumors up to 5 centimeters. Now if there are multiple tumors, we cannot go and burn every tumor from outside, it's difficult. So in such patients, what we do is something known as TACE. So this TACE can be done even for larger tumors which cannot be burned easily from outside. So what we do is we go in through one of the blood vessels that is supplying the tumor, and we put in a small amount of drug, which is usually a chemotherapy drug, and that drug will go into the tumor and completely destroy the tumor through the blood vessel. So this is an angiographic procedure where we do it from outside. So this is known as TACE. We can also put in radio therapy beads to destroy the tumor through the blood vessel, and that is known as TARE, that is transarterial chemoembolization or transarterial radioembolization. So these are the options in stage B. Now when it comes to stage A and B, another good option is to go for a liver transplant because it is curative. So you're taking care of cirrhosis as well as the liver tumor or the liver cancer. Because if you are going to burn the tumor or do a TACE procedure and burn the tumor using the drug, there is still a chance that these tumors can happen in the future also because the cirrhosis is still there. So to completely cure the patient of cirrhosis and future cancers, we offer a transplantation. So this is very good for younger patients who needs longer survival benefit. So transplantation is curative, and patients who are good candidates for liver transplantation should be considered for liver transplantation because it is curative. And only catch here is that even if the tumors are within liver transplant criteria, some patients will have very high levels of AFP, that is alpha fetoprotein. If it is much higher than 400, then in thousands and lakhs, then there is a high chance that even if you give a new liver, the tumors can develop in the new liver. So in such patients, we either do TACE or TARE or RFA, something like that, and give some oral medications to reduce the tumor activity to bring the AFP down, and then offer a transplant. So this is also possible. And we have done a lot of patients, we have done liver transplantation for a lot of patients like that. This is known as downstaging. There is a stage where cancer cannot be cured with a transplant. We bring it down to a stage where we can cure it and offer a transplant. Now in stage C, things are very different. So in stage C, we cannot offer patients this burning or putting the drug through the blood vessel because already it has spread into the blood vessel. So in such patients, we offer medical treatment. So for that, we have injections and tablets. So the injection option is something known as atezolizumab and bevacizumab combination, and which is the number one option in these patients where there is immense improvement or downstaging of these tumors with this biological therapy. But the only catch is that it is very expensive, so not many patients can actually afford it. The second option is to go for tablets. So we have tablets like lenvatinib, sorafenib, regorafenib. There are a lot of options in that, and we put them on these medications for about 3 to 6 months, and then reassess these patients to see if there is any improvement in tumor burden, reduction in alpha fetoprotein, and if we can actually offer them one of the previous options that I spoke about, like RFA or TACE or TARE, to further reduce the tumor burden. Now, when patients are in stage D, that is metastatic, that is beyond the liver, there is no other option other than palliative care. So in such patients also we provide a comfort care along with these medications that can reduce the tumor burden and also take care of complications of cirrhosis like removal of fluid, nutrition therapy, treatment of bleeding, treatment of infections, treatment of low sodium levels, etc. Now, most of these patients, this is standard according to guidelines. But we have seen that in some patients, there is this new type of therapy known as SBRT. So that is stereotactic body radiation therapy. In stereotactic body radiation therapy, we apply a radiation very focused from outside the body to that particular tumoral area, and we can actually melt away the tumor. So the tumor is gone. The spread part of the tumor, that is tumor that goes into the blood vessel, can also be taken care of. And we have had great success in treating patients who were advanced liver cancer, and doing this SBRT, we have brought them down and their cancer has completely disappeared. So many patients actually go cancer free, cirrhosis will remain, and when they're cancer free and we only have to deal with cirrhosis and its complications, we have offered them transplantation as a complete cure also. So coming back to this particular patient, where two of them, we offered both the patients we offered SBRT because we were anyway going to give them medications, but as an additional benefit we offered them SBRT, that is the stereotactic body radiation therapy. One of them denied and he went for homeopathy, and one of them we could do SBRT for him. He underwent SBRT, which is a very simple procedure. It does not even require admission. He came to the OPD every week, took the radiation and went home, and we did 6 cycles on him. And by the end of 3 months, when we did a repeat CT scan and MRI on this patient, we saw that he was completely tumor free. That is, his tumor had completely gone off. The whole extension of the tumor into the blood vessels has completely disappeared. His alpha fetoprotein from a level of 6,000 had come down to 6, that is less than 10. And he was completely tumor free. And now he is on follow-up because he has no other major complications of cirrhosis, and he is ready for liver transplantation once his liver cirrhosis complications start to happen. So this patient is doing very well now. But what about the other patient? So the patient who went for homeopathy. So he went for homeopathy to a major homeopathy practitioner in Heartland, Kerala, one of the major centers in Kerala. Then he underwent 1 month of homeopathy treatment with various diluted substances, pills and whatnot. And ultimately, after a month and a half, he came back to me. So he came back, and he came back not walking, but he came back in the emergency with a massive bleed. So we admitted him in the ICU, we controlled his bleed, and we did a repeat imaging, and we saw that his liver cancer had actually spread out of the liver into his lungs also, and also the bones. So that was actually stage C to stage D. So homeopathy, what it did was, basically when you treat cancers with water, what essentially happens is that the cancer will progress. And this is exactly what happened to this patient. And within the next 2 weeks to 3 weeks, we could offer him comfort care and end of life care, and he passed away peacefully at home on palliative support. While the other patient is still following with us, now it's almost 2 years, and he's doing well. He is following up regularly, and there is no recurrence of his tumor, even though cirrhosis is there, and he's doing fine. Which brings us to the most important aspect of this video, which is about homeopathy. So what is homeopathy? I mean, I'm sure everybody has heard this term that, homeopathy is no effect and no side effect. So if there is no side effect, why not go for it? That is exactly the problem, because we are not looking at side effects, we are looking at effects. If something is effective, we can automatically identify if it has any side effects. But if something is not effective, then what is the point in going for it, even if it has no side effects? And this is a classical example. A patient who actually could have been salvaged and saved and we could have given him a longer life. He chose to go for homeopathy because it had no side effect in the first place, and obviously he did not have any side effect because he was getting water. And what ultimately happened was that his disease progressed and he died within 1.5 to 2 months. So no effect, no side effect is not the reason why you should choose a particular treatment. You have to see if it is effective, and if it is effective, is the benefit more than the risk? If the benefit is more than the risk, definitely that is the treatment that you should choose for. For example, curative treatment for liver tumors, liver cancers is transplantation. So in these patients in stage C, we could offer them liver transplant, but we did not. Why? Because liver transplant is more of risk and less of benefit, even though we could have done it for them. More of risk, why? Because already they had progressed, the tumor had gone into the blood vessels, their alpha fetoprotein was very high. So we know that if we do that for them, liver transplant for them, they are going to suffer. So what did we do? We chose the next best option, which was more beneficial, less risky, and that worked out. But when you look at homeopathy, it was no benefits, no risk, it did not work out. So homeopathy is a system of medicine. I won't call it a system of medicine, it is just a system where they mention that like can cure like. So for example, if some substance can produce fever in my body, that same substance in diluted forms can actually be used to treat fever with somebody who actually has fever, which makes absolutely no sense. So for homeopathy, principles are based on complete bogus. It is not even science. It is basically thoughts and beliefs of the person who identified or discovered homeopathy, that is Samuel Hahnemann, and which has been practiced down the ages. So Samuel Hahnemann he did it all for the good, because at that time allopathy, which is not modern medicine, allopathy is an ancient medieval practice where they used to actually do a lot of therapeutic options for the patient which were associated with huge side effects. For example, bloodletting, hammering on the head for headache, giving substances to make them vomit, cause diarrhea, things like that. So Hahnemann saw that and found out that patients were suffering. So what he did was that he wanted to reduce the suffering, so he actually decided that no medicines should be given, because he diluted the medicines out of this world. And he diluted them so much that there was no medicine or no active principle or active compound left in whatever he was giving. And classical homeopathy is basically water. And if you obviously give water, there will be no side effects. So the side effect part of allopathy was taken care of, but there was no effect. So people actually overlook this part and give homeopathy thinking that it is working, when absolutely it does not. So this is not what I am saying. So I'm going to show you a lot of publications, studies, and also a lot of scientific documents that governments all over the world have produced, showing that homeopathy is actually sham treatment. In some cases, it is as good as placebo. In some cases, it actually is a harmful placebo, for example, in liver cancers. So what is the role of homeopathy in liver cancer? Absolutely none. Actually, homeopathy has no role in any cancer or any disease per se. Homeopathy is very good for certain diseases. I can give that. Homeopathy is very good for common cold. Homeopathy is very good for insect bites. Homeopathy is very good for seasonal allergies. And homeopathy is very good for every disease under the sun, which will go away on its own. So seasonal allergies, when the season changes, the allergy goes away. Insect bites, on its own it will go away. Common cold, whether you treat it or not, it will take 5 to 7 days and go away. And if you take any other disease like maybe hepatitis A, which is a self-limiting cause of jaundice, it will go away in a few weeks time. And if you give homeopathy or not, it is going to go away. So in these conditions, homeopathy is very effective. So if you want to spend money and take homeopathy for these self-limiting conditions, please, you can do that, because it's as good as drinking water from your fridge. But is homeopathy all safe? No, because there are multiple studies, including systematic analysis and meta-analysis, that has shown that homeopathy can actually harm too. Why? Because homeopaths themselves know that classical homeopathy is sham, because they are essentially giving water and sugar to the patients. So what they do is they give a highly concentrated form of homeopathy. For example, they use mother tinctures, which actually has very high levels of alcohol and very high concentrated forms of the substance, which can actually cause side effects in the patients. And that is how patients come to us with a lot of adverse events like liver injury, kidney injury. Some patients even develop alcoholic liver disease with homeopathy. Not only that, when patients choose homeopathy, they are actually directed away from the right treatment at the right time. So the loss in time actually makes the disease worse. The diseases that actually require treatment, they become worse, or they progress during the homeopathic treatment, and they come with a more complicated illness course, like our patient did in the case of liver cancer. And then it's too late for them to get the proper treatment, and some of them actually die, or some of them become moribund. They become morbid. So homeopathy practice, even though it is widely accepted by various governments and also in the society, especially for children, by parents and school teachers and whatnot, the whole aim of homeopathy is to just make you lose money. And you are wasting your money on water, sweet substances, and sometimes spike with alcohol. And this is not the way to scientifically treat, because homeopathy was discovered or written at a time when there was no light bulb. It was early 1800s. Light bulb was not discovered at the time, and that was the time when homeopathy was discovered. So you can imagine how much of a primal treatment option that is if you're going to choose it. So this is 2022. So I would suggest that people become more aware of great options for them to treat their disease conditions, especially cancers. So with liver cancer, now we have to treat liver cancer according to the stage of the cancer and also the stage of the underlying cirrhosis. and liver cancer is not the end, because now there are such great options even for advanced liver cancers like SBRT, where we can actually give patients a cancer-free life, and in some patients we can offer them transplants and cure them and give them very long survival benefits. So please remember, follow the science, follow the evidence, completely deny pseudoscientific treatments if you want to have a healthy life and go for a disease-free life. Until next time, I hope you enjoyed this video. Please subscribe and turn on notifications. I'll see you again.